weeks, we have been documenting stories of how healthcare providers who are yet to get their allowances are working in dilapidated facilities in some states after a COVID-19 vaccination program in Nigeria. On this episode of Community Forum, we journey to Ekiti State, southwest Nigeria, to see how health workers work tirelessly to get everyone vaccinated and how small businesses are recouping losses incurred during the pandemic. For more than 5 years, motorists plying the Akure-Ado-Ekiti highway have agonized over the deplorable state of the road. A trip which used to be made in 35 minutes has now stretched to 1 hour 50 minutes. There is no form of respite. This highway, which used to be the shortest and busiest link between the two state capitals, gets lonely and dangerous for travelers who now get to use the only available lane in and out of Ekiti. The other lane is still under construction. Ignoring the craters and potholes, we got enthralled by the beautiful landscape inside, appreciating the creativity of nature. The Singly and ridge-like mountains provided a spectacularly majestic scenic view of Ado-Ekiti. But beyond the beauty of the town lies many issues. One that stands out is the riveting effect that the COVID-19 pandemic has had in many communities here. Micro, small and medium-scale enterprises are recognized as the engine of the economy and important contributors to employment as well as economic growth. The data shows that in Nigeria, small businesses contribute 48% to the national GDP, account for 96% of businesses, and are responsible for 84% of employment. With the advent of COVID-19, business activities across Nigeria took the heat. Full and partial lockdown measures also had an effect on low sales and patronage among the enterprises in the education sector. It has now been 3 years since the first case of coronavirus was detected in Ekiti State. The small businesses are yet to fully pick up. Toyin Ogumiloye is happy business is gradually improving. She says in her 20-year journey as a tailor, the hunger she felt during the peak of COVID was unprecedented.
So orí ọ̀fẹ́ yẹn á kàn wọ́n á jẹ́ kí gbogbo ẹ̀ náà kó túbọ̀ rọrùn sí láti ṣe. Torí ẹni tó ń ṣiṣẹ́ ọwọ́ ń sìn tó bá rówó ara nǹkan ṣùgbọ́n ẹni tí ò ṣiṣẹ́ àti ra nǹkan á difficult fún àti ta àwọn ọlọ́jà yẹn náà á difficult fún àti jẹ gan gbà yẹn gan ó nira. Irú àwọn oníṣẹ́ ọwọ́ yìí báyìí tá à níṣẹ́ kankan ju pé ká ránṣọ yìí owó tá a bá pa la fi ń bọmọ náà la fi ń jẹun òun làwọn ọmọ wa fi ń develop. So ìgbà tí ò dẹ̀ síṣẹ́ tí ò sí nǹkan kan ó jẹ́ kí gbogbo ìgboro yẹn nira fún wa láti ṣe nǹkan tó yẹ ká ṣe àti jẹ nínú ilé gan gbà yẹn ó nira. Torí nǹkan tí mi ń ṣe rí ngbà yẹn mo ṣe àwọn tí mo ti ṣe fún rí mi ní right kò yẹ kí n lọ bá wọn ṣùgbọ́n mo lọ bá wọn ngbà yẹn tí mo sọ fún wọn pé nǹkan tán bá ní kán fún mi kí n lè ní oore ọ̀fẹ́ àti jẹ ngbà yẹn.
While Toyin's story offers a glimmer of hope, others like Coach Pius are still waiting for the much talked about palliative from the government.
The pandemic has really affected my business. Because during that period, we were unable to open our business, and during the process, we lost many customers. We lost many customers in the process, and during that period, there's no any provision from the government to cover up those lapses. And by the time we are resuming back, a lot of damages have occurred in our business due to low level of the usage during that period. And then the level of the turnover, up to now, we are still facing the challenges because the turnover is at minimum compared to the before as a result of the pandemic. If I have to approximate the loss, it's nothing less than 2 million naira because the period almost covered, almost run for a year. And during that a year process, till now, we are still because during that period, we happen to be on loan to support our business. And then during that period, the loan we are financing when the income is not coming in. Meanwhile, by the time we are resuming to the business, we have to continue from the debt. And for us to be escaped from the debt now, it's not an easy task. I cannot mention a single person that I know that he received it. But people who are saying it, but I repeat, I don't have any evidence. Because I believe in what I see with my naked eyes. And unfortunately, in the situation by, I cannot pinpoint a single person. That shows for me not to build my facts on empty. I have to repeat, I cannot mention a single person that received among my people.
Apart from the COVID-19 pandemic, epileptic power supply has persistently crippled the potential for business success in the country, as the unstable nature of the grid has not only thrown the country into darkness, but also forced manufacturers and small businesses to embrace expensive alternative power sources.
Broader than just a health plan, we recognize very quickly that this could have economic impacts and security impacts for the state. And so when COVID came, the immediate past governor, Dr. John Karadifayemi, had set up a committee to begin to think through what needs to be done from a strategic point of view as a state. That was even before first COVID case hit us here in Ekiti. So that was set up, called the RRMC, essentially. It was a squad of people within and outside government who were able to support the state. And what we focused on broadly was, there was the health component in terms of ensuring that we had the preventive support, we had the curative support, or what you call like management support, but also making sure that we had economic support for families and households who were, who probably were caught up in this.
During the peak of the pandemic, the state government said it invested heavily in healthcare provision and delivery for both 2020 and 2021. The government insists the increased expenditure has helped the state achieve successes in the fight against coronavirus. It prides itself as the best in humanitarian service during the COVID-19 lockdown.
Things changed the game, right? We now had very clearly a plan to minimize disruptions to our system, but more importantly, to also help to prevent, right, to a large extent. And so we set up a team within the broader Emergency Operations Center, the EOC, to focus specifically on vaccinations. We have a cold chain store where we're able to store all the vaccines that we receive from the federal government, and we distribute this down to the local governments and from the local governments to the facility. But we recognize that given the uniqueness of COVID, right, of the pandemic, it was not enough to sit down in the facilities and expect that people will come. So we have teams that go out on the field. So today we still have over just a little under 200 teams, right, that are mobilized into the communities, making sure that we're able to vaccinate as many people as possible. We received support from a number of our partners, and that allowed us to very rapidly increase access to COVID vaccines across the state. We now use Johnson & Johnson, which is a single-dose vaccine, and so that's also allowed us to very quickly hit the vaccination target rate. As of today, we've done 73% of our eligible population, so which we're in a good place. We're number 7 in the country in terms of the pathway. And our health workers have done an excellent job, I think we can say so, of course guided by the political support and commitment of the government to do that.
From outside, the Takwa Health Facility in Oya local government looked its best. Taking a cue from the red earth and sun, the paint on the walls showed the building just had a fresh touch. In the distance, we see mountains sheltering the facility from the sweltering sun. One would easily think it's a government project, but locals are the ones renovating the facility.
Ní basic care center Ìtàpá Ekiti, a ní
ilé tó dáa, gbogbo àwọn the other building ló ti bàjẹ́ tó ti wó àti sá kúrò ńbẹ̀. Ibi tá a wà yìí àwọn community ló kọ́ fún wa, so tá à ń manage ẹ̀ ibẹ̀ náà ò gbà wá, so kò síbi táwọn aláboyún gan fẹ́ dúró sí tán bá bímọ tán, kò síbi tán máa dúró sí, kò síbi tán ti lè wẹ̀, so gbogbo nǹkan wọ̀nyẹn la bẹ̀yìn kán bá wa ṣe. Kò sí ṣíà, bẹ́ẹ̀dì ò sí, kò sí mattress, kò sí bedsheet, ordinary bedsheet ò sí bẹ́ẹ̀, so àwọn community yẹn náà ṣe lọ́n bá wa rà nìkọ̀ọ̀kan, so ìjọba ò hàn gbé fún wa. Then staff, kò sí staff tó bá ṣe morning òun ló máa ṣe afternoon. Mo tẹ̀rí ìgbà tó jẹ́ pé òun látún ṣe night torí àpọ̀ rárá síbí shiftings mẹ́ta ló yẹ ká máa ṣe, láti ṣe méjì gan ó difficult.
One solar panel on the roof to power the vaccine store. No electricity to do any other thing at the facility.
Solar tá a ní solar ilé tó ń tanná oní kìíní náà gbé fún wa. Wọ́n dẹ̀ sọ pé a máa ṣáàjì nínú ìkan kékeré tó wà lẹ́gbẹ̀ẹ́ bẹ̀ tí wọ́n bá wá wọ́n store ẹ̀, so ó wà ń bẹ̀, so a ní anything.
Months after coronavirus dictated everything, all the hand wash basin and soap have now been abandoned. They are no longer considered a necessity. Since this center lacks basic work tools, health workers are leaving in search of better work environments and welfare packages. The facility has no access to potable water. The hand pump stands in the weed, useless to the health workers. Every day, the health workers move to specific locations, hoping people will come for the vaccines. This facility covers about 15 settlements in Itakwa and Osi communities. The health workers say they are yet to receive their allowances months after the Scale 3.0 vaccination program ended.
Ṣiṣẹ́ gan wọn fún wa lówó ẹ̀. A ṣe 90 days kan báyìí wọn fún wa rárá lówó ẹ̀. Eléyìí tá tún ń ṣe lọ́wọ́lọ́wọ́ tó jẹ́ pé a tún sá ojoojúmọ́ là ń lọ káàkiri là ń lọ, wọn fún wa lówó ẹ̀. Wọ́n san ẹ̀kan oṣù náà fún wa. Nǹkan náà dẹ̀ sọ fún wa tẹ́lẹ̀ ni pé wọ́n máa san ní 2 weeks fún wa, bẹ́ẹ̀ tí wọ́n san láti gbà yẹn báyìí láti bí August yẹn wọ́n fún wa ẹyọ ọ̀sẹ̀ méjì kan náà ìsánú ẹ̀. A dẹ̀ stop iṣẹ́ àfihàn ṣe pé à ṣiṣẹ́ à ń ṣe. À ń mobilize àwa náà là ń mọ̀ bá ṣe ń lọ bá ṣe ń káàkiri bá ṣe ń bá àwọn èèyàn sọ̀rọ̀.
So owó lè wá ní láti wọlé àwọn communities?
Owó ara wa ni, owó ara wa là ń ná. Wàhálà tá a ṣe lórí iṣẹ́ COVID yẹn ló lágbára jù. Ẹlòmíì gan ó mú tó jẹ́ pé Ọlọ́run ló là á bí tá a ti ń sá kiri.
Vaccination picked up slowly because of skepticism, but the narrative has changed.
So ìgbà tá a fẹ́ bẹ̀rẹ̀ iṣẹ́ wọ́n á bẹ̀rẹ̀ lórí health worker. Bá a ṣe dé tá a dé bí báyìí gan ọ̀pọ̀lọpọ̀ ló ń bẹ̀rù láti gbà á. Because gbogbo wọn ló ń bẹ̀rù, but me and World Foca, I immunize World Foca first. They immunize me, so I immunize them and we are working and we are doing something. So ìgbà táwọn èèyàn wá rí pé àṣubú kò sí nǹkan tó ṣe wá, so wọ́n wá ń gbà ní ìkọ̀ọ̀kan ẹlòmíì gan ṣì ń sá till now. After we immunize the health worker, we move out to police station. We immunize them. Then we move out to the town, to the community. Meet the chiefs and king. We immunize them. So after some months, they are coming to come and take the injection for themselves. Àtìgbà tá a ti bẹ̀rẹ̀ a ti immunize 7,118 èèyàn. Still now wọ́n dẹ̀ ṣì ń wá. Even vaccine kan wà gan tó jẹ́ pé àrí náà tàn ìgbédé tó jẹ́ pé àwọn èèyàn ń wá tán complain láti gbà Pfizer. So people we are coming now, even some people they are begging, I need it.
The Ekiti state government says the basic healthcare provision fund has been helpful in addressing infrastructural challenges in the health sector. The BHCPF is a federal government initiative through which 1% of Nigeria's consolidated annual revenue and partner resources are deployed to guarantee a defined package of care and provide operational budgets for PHCs.
National policy around primary health care, which is called the PHC under one roof, and embedded within that is something called the 1 PHC per ward, right? And this recognizes that most states have a good number of primary health care facilities but do not have the capacity to be able to address all of them. And the ward being the smallest unit of engagement at the community level, the national resolution is that we have 1 primary health care in each ward. In Ekiti, that means that we have 177 PHCs that we should focus on, right? Of course, we have more than 177 primary health care centers in the state, but the goal is to focus on 177. Keep them up to standard, make sure that we have the commodities available, make sure that we have the health workers, and that's where we're prioritizing. As of today, we've renovated about 100 of them, trained about 1/3 of our healthcare workers at the state level, at the primary healthcare level, and we've completely revamped our drug management agency. We set up a law to ensure that it could work. It only just started last year. It's done over 300 million in revenue in the last 1 year. Recognize that for the patients is really 3 things. One is you tell them if you go here, that means there's infrastructure and there's equipment, right? You meet X person, that means there's a health worker that is competent and available, right? And that you get Y drugs, right? So we've tried to address it in that form. But government is a continuum. You're never going to finish everything in 1 day. And even if you renovate today, 6 months down the line, 1 year down the line, there may be need for touch-up. So we continue the renovation, but also using the opportunity of the Basic Healthcare Provision Fund, which allows us to ensure that, again, the 177 facilities receive about 100,000 naira per month, right, for operational expenses. So we'll continue to do this. It's possible that the one you probably visited was outside of the 177. If it was part of the 177, then you would have seen a signpost outside. Excellent. So you would have seen that, and what you would then see is that there will be slowly but surely in the right direction some elements of renovation. Some of the health workers, for instance, may have been part of those who have been trained, and will continue to do that.
In Idosi local government area of the state, electricity poles surround the primary health center in Sharp Corner, Ekiti. Ironically, electricity supply at the facility is elusive. The signpost outside reads 24 hours service, labor and delivery service, laboratory service. But inside, not much is seen. The signpost looks cleaner than the facility. The walls and gates bear washed out paint. Some parts of the railings cut up in the overgrown weeds. There is a security outpost, but there is no one to man it. An abandoned water storage project opposite the security outpost tells you the facility needs more than a freshly painted signpost to cater to the health needs of residents here.
We need water for delivery in the labor room. We need water in the laboratory. We need water to clean our environment, even to wash our hands, to take care of the patient after the delivery, even to take care of the baby. We need water. So that's the problem we are facing, because no light. We are only using the generator. You can see the problem we are facing with the generator, on and off. Can this one help us? At times, after pumping the water now, using it for just a week, after a week, on the generator, we have problem with the generator. And the solar cannot even carry the generator. No, it cannot carry. No, it cannot carry the pumping machine. No.
This facility seems a lot better than the ones earlier visited. Here there are 20 health workers, comprising technicians and support staff managing the facility. This is one of the 177 PHCs recently refurbished under the 1 PHC per ward policy. The facility runs a 24-hour shift without electricity.
It's road. We need water. We need electricity. More offices. At times when we are on night shift, if patient comes in the night and this place almost becoming dark, it is difficult for the people, the health worker that is on duty, to attend to them easily without the light. So sometimes we use torchlight, solar light to attend to them. If we have electricity, this place will be brighter than using the torchlight or solar.
So you have solar?
We have solar, but the solar is not enough for, it's not in every rooms. We only have it in the labor room and the OPD, the government, from the government.
Provided generator?
Yes.
So, so if you don't have electricity, you can still depend on generator?
Yes.
So who fuels it?
The center.
Like you guys use your money, or there is an allocation?
We use our money.
To fuel the generator?
Yes.
The facility is known for its adherence to routine immunization. While the health workers tend to residents, they silently rein in thoughts of empty pockets and poor welfare structures they are subjected to.
COVID yẹn wà lóòótọ́, but nígbà yẹn àwọn èèyàn ń gbà ó dẹ̀ ń react. Some lè sọ pé òun ní headache, ẹlòmíín lè sọ pé òun sùn ọjọ́ méjì òun ò lè dìde, ó ń react sí. But tó bá ti di bóyá after 3 days wọ́n á sọ pé irú nǹkan bẹ́ẹ̀ yẹn ò ṣe wọ́n mọ́. Ìgbà tí vaccine yẹn kọ́kọ́ jáde ó wọ́rí àwọn èèyàn tó yẹ pé àwọn míì ò fẹ́ gbà gan gbà yẹn. Ìgbà yẹn gan eléyìí tí mo ṣe ìgbà tán ṣe bẹ̀rẹ̀ eléyìí lèmi ṣe bá wọn gba ẹ̀ méjì tèmi gbàǹgbà yẹn torí èmi náà ń fear of it báwọn èèyàn ṣe ń complain pé ó ń react lára wọn. But reaction ẹ̀ náà kì í ṣe nǹkan tó lọ títí bíi bóyá some 3 days àti fi wọ́n lẹ̀.
Shortages of specific vaccines leave Nigerians in a limbo. Now that they want it, the vaccines are not available in these parts.
Nǹkan tí mi kàn lè sọ fáwọn government because ìgbà tá a ti bẹ̀rẹ̀ program eléyìí tá à ń ṣe yìí wọ́n sọ fún wa pé wọ́n á máa sanwó fún wọn weekly ni, but now a ti bẹ̀rẹ̀ iṣẹ́ yẹn around August 29 ẹ̀ẹ̀kan náà yìí fún wọn lówó, wọ́n fún wọn lówó ní October 8 ni wọ́n ti sanwó. So èmi tí mo wà ń bí nísìn àwa tá à ń ṣiṣẹ́ 6 ni wá, we are in 6 in number, but mi pé ibi tán ti ń wọ mọ́tò wá because kì í ṣe àwa staff lórí lè wà ní iṣẹ́ yẹn pé kó lè kárí kán lè ṣiṣẹ́ yẹn bó ṣe yẹ kán ṣe náà ṣe gba àwọn èèyàn láti ta wá mo rẹ́ni tó ń wá látàdónú wa, but ìgbà tán wá san owó fún wọn làwọn yẹn fi wá dúró ní ilé wọn. Ẹ̀mídì yẹn tá àjìjọ ń ṣiṣẹ́ èmi àti ẹ̀ la máa ń ṣe mí pé àjìjọ jẹ́ staff ń bí báyìí, but meeting tó lọ ni ò jẹ́ kó ń wà around. Nǹkan tí èmi kàn lè sọ fáwọn ìjọba ni pé tán bá ti promise kán máa mú ìlérí wọn kán mú ṣẹ. So tó wáyé pọ́n fún wọn lówó nísìn àwọn èèyàn lè ṣiṣẹ́ wọn. So àwọn kinní tá à ń lò bẹ́ẹ̀ yẹn tá à ń fi mobilize káàkiri gbogbo ẹ̀ ló wà nù bí tán ṣe tán gbé fún wa, but ìgbà tí ò sí owó ẹ̀mídì wa gan gbà mí owó dátà kò ní rí owó dátà ń gbà mí débi pé kò ṣiṣẹ́ yẹn. So owó ni problem tí mo rí pé wà ń di iṣẹ́ yẹn pé wọ́n ń ṣe ìlérí wọn kì í mú ìlérí wọn yẹn ṣẹ. Kán fún wa ní nose mask láti máa lò kò sáwọn nǹkan bẹ́ẹ̀ yẹn, wọ́n fún wa ní cotton gan àwa fúnra wa là ń provide cotton wool láti ìgbà tá a ti bẹ̀rẹ̀. Yes, cotton wool kò sí lára nǹkan tán provide fún wa. Complain gbà yẹn àwa fúnra wa la máa ń fún la máa ń lò tì náà. Ìgbà yẹn ó yẹ kán mú nose mask wá kí glove dẹ̀ wá ń bẹ̀. So lẹ́yìn ẹ̀ kò tún sí kinní.
The facility has an abandoned laboratory behind it. The lab technician tries to carve out work for herself, even though she has few tools and sparse electricity.
Here we need to equip the laboratory. There's no cabinet. We need cabinet here. Yes.
So when you take samples, where do you put them? Where do you store them?
We just manage to do our test here. We need cabinet where we can conduct our test.
And so when you take the samples, how do you store them? How do you...
Immediately you take the sample, we have to do the test. Immediately
So
we do
you
the,
just conduct the test by
yes,
yourself and then
yes.
send the results?
Yes, immediately. So
Generator not on.
Generator that is drying up and down. That's the problem we have here. Wow. We don't have light.
So
then at times, this our centrifuge is using light, but because of the problem of light now, at times we don't use it.
So what are we supposed to use it for?
Centrifuge for spinning of the patient, for the spinning of the sample of the patient, like blood and urine.
So you can't even use that?
We can't use, there's no light. Wow. So, but we use this one for fasting blood sugar. This is for HIV test. This is for PCV.
So I hear that you guys buy your own...
we do buy it.
For the room?
Yes. Though, a few months ago, government gave us money to buy some kit for the free health. I mean BA program, and we are running it. So we have to, that will give us opportunity to have some kits. Like we did hepatitis B, wider test, typhoid test, urinalysis for the patient, fasting blood sugar, blood group.
1 second, the light comes up, then it goes off after a minute.
Tabadẹ̀ ti ní àwọn patient tó fẹ́ bímọ bẹ́yẹn tí ò bá dẹ̀ ti sí omi, wàhálà ló máa ń jẹ́ fún wa. That is why tá a fi lọ ń ra epo sínú jẹ́ ẹ̀wà tá a máa ń ṣe láti lè fi pọ́ǹpù omi.
There's something I call the gift and the curse of COVID. The curse being, of course, that we lost people, right? Also mortality across board, not just in Ekiti, but across the country, but across the world. But the gift particularly for us was that we were able to mobilize additional resources, and we've used that to strengthen the health system, right? Part of strengthening the health system is making sure that our public health security network is better prepared and responsive, right, to a potential outbreak, but also making sure that normal service delivery continues to happen in our primary healthcare facilities, and that's why we've rapidly renovated about 100 that I mentioned earlier on, and used the opportunity to train about a third of our healthcare workers at the primary care level. So that's the gift in itself. We don't obviously pray for another pandemic, but there's very clear interest from the highest level in terms of health. His Excellency, the Governor of the state, Mr. Abiodun Banji, was sworn in as a governor on the 16th of October. His first appointment was a Commissioner for Health on the 17th of October. So I don't think there's a greater political will, right, or indication or signaling that is committed to the health sector than that. Just finished the budget process. Most of what we've requested for to ensure that we're able to deliver adequately, if not all, has been accepted and agreed to. So we're grateful.
With reports of the re-emergence of COVID-19 in Nigeria, it is hoped that electricity delivery will be improved across all levels of governance to tackle these challenges.